Abnormal psychology, culture and abnormal psychology is conception of abnormality differ between culture. Again, a conception of abnormality differ between culture. Ethnicity, social class, or gender influence diagnosis and treatment. Okay, ethnicity are factors such as ethnicity, social class, or gender usually influence diagnosis and treatment. Okay, perspective on abnormal behavior. Usually, this abnormal behavior, it is about pattern of emotional, cognitive behavior and behavioral problem. Behavior that is disturbing. This is definition of abnormal behavior. Behavior that is disturbing, socially unacceptable, distressing, maladaptive, and often the result of distorted thoughts, which is cognition. Some of you, for assignment topic, some of you have topic that I gave to one student is about abnormal behavior and marriage conflict. Marriage conflict. What you can discuss about that topic is about maybe you can maybe it is indirect link between abnormal behavior and marriage conflict. What I can suggest is that you can discuss about abnormal behavior that's abnormal behavior and depression. Depression is one of the psychological symptom related to abnormal behavior. So you can discuss about marriage conflict and depression, like that. Okay, perspective to explain the cause of abnormal behavior. There are several perspectives to explain the cause of abnormal behavior. Medical perspective, psychodynamic, behavioral perspective, cognitive and sociocultural perspective. Okay, in medical perspective, it focuses on biological and physiological factors as cause of abnormal behavior, which is treated as a disease or mental illness, and is diagnosed through symptom and cure through treatment. Okay. And hospitalization and drug are often preferred method of treatment rather than psychological investigation. This is from the medical perspective. It is different from other perspective like psychodynamic perspective. Psychodynamic perspective is alternative to medical model. It's a psychological disorders are according to this perspective. Psychological disorders are the consequence of anxiety produced by unresolved unconscious conflict. If you look at the Freudian psychoanalytic theory, it's related to this theory, Freudian psychoanalytic theory, which we state that psychological disorders are the consequence of anxiety. Okay, and then usually treatment focus on identification and resolution of the conflict. Okay. Okay. The third one is the behavioral perspective. According to this perspective, abnormal behavior result from faulty or ineffective learning and conditioning. Okay, treatment are designed to reshape disordered behavior and using traditional learning procedure to teach new, more appropriate and more adaptive response. Okay, it's different from the previous one, because this behavioral perspective stress on the effective learning and conditioning as a result as a result of this as a factor that as a factor for abnormal behavior. Okay, for example, we can see the example in abuse case, a behavioral analysis of a case of child abuse. For example, might suggest that a father abused his children because he learned the abusive behavior from his father, and must now learn more appropriate parenting technique. Okay, parenting tactics. Okay, this is example of the behavior perspective, meaning that this abusive, for example, the abusive behavior should be corrected. From the therapy of behavior. Okay. Number 4 is cognitive perspective. Particular thought and behavior that are often based upon their false assumption. Particular thought and behavior that are often based upon their false assumptions. Okay, treatment are oriented toward helping the maladjusted individual develop new thought process, and new value. A therapy is a process of unlearning maladaptive habits and replacing them with more useful ones. Okay, so the treatment is the treatment is provided through therapy, cognitive therapy, because from this perspective, the mind, the thought and behavior that should be corrected. That's why they have abnormal behavior, because of their thought and behavior. So the cognitive therapy is suggested to correct their behavior based on this cognitive perspective. And the last one is a socio-cultural perspective. Abnormal behavior is learned within a social context, ranging from the family to the community to the culture. Okay, according to this theory, they said that abnormal behavior come from a social context, because of this factor, because of family, community, and the culture as a whole, socio-cultural perspective, or socio-cultural environment, because of the socio-cultural environment. Cultural variable acquired through learning and cognitive process are believed to be important in producing abnormal behavior. Okay? So in this perspective, cultural behavior, socio-cultural behavior, that a factor that that lead to the abnormal behavior. Okay, Sanjing Chuairo in China is one of the example of this abnormalities. We call it abnormalities. The culture specific culture-borne syndrome. Syndrome that related to culture specific. Some abnormalities are culture specific, like since this changing Huairou in China, because this disease, these abnormalities, is only in China, not in other countries. Okay, and then it's specific to China population. That's why this Shenjing Shuairo is a culture specific abnormality. It is a neurasthenia, also known as it has characteristic of neurotenia, which is a weakness of is a symptom of the nervous system. Weakness of the nervous system. People in China indicate this symptom: physical and mental fatigues, inability to concentrate, loss of memory, insomnia, sexual dysfunction, and gastrointestinal distress. Okay, actually, this one is included in Chinese classification of mental disorder, but not in American diagnostic classification system of mental disorder. It's not recognized by American DSM disease classification. Yeah. But later after that, APA recognized culture-borne syndrome in 1994. Okay, after that, APA recognized this Shenjing Shuairo as a culture-borne syndrome. It is in 1994, but listed separately in the appendix of DSM-4. Another thing is that there is a report saying that depression is less in ASEAN people, because they say according to that report, depression also is one of the psychological state that is can be classified as a cultural specific because they said depression is less in ASEAN people as compared to Western people, because they say that ASEAN people usually live in extended family, so they have more social support from the family. This is from one report. I think it's not correct. All people in this world have equal potential to have depression. Not only ASEAN people, not only Western people, but also ASEAN people. Okay. Okay, this one is another example of cultural-borne syndrome. Culture-borne syndrome, as I said just now, is a psychiatric and somatic symptom in specific culture. If we look at here, Amok is one of the culture-borne syndrome in Malaysian population. Amok is a dissociative episode characterized by a period of brooding, followed by an outburst of violence, aggressive or homicidal behavior. Okay, Amok. And you can see here another example of culture-borne syndrome. Another one from Malaysia is Koru. Koru, a sudden and intense anxiety that the penis will recede into the body and possibly cause death. Okay, and then you can see another example of culture-borne syndrome from different countries. But I'm not sure whether it's this culture-borne syndrome recognized by 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 disease classification, American disease classification. I'm not sure. Okay. Cultural bias. Cultural bias can come from cultural bias. We can classify into three. Cultural bias in mental health, cultural stereotyping, and cultural blindness in diagnosis. Cultural bias in mental health, for example, significant difference in prevalent rate of for mental disorders between ethnic group in Britain. There's one report that that explain that describe the mental that report there's one that report the different the prevalent rate for mental disorder between different ethnic group in Britain. Significant difference in prevalent rate between ethnic group in Britain. Apa? This is actually this is cultural bias. Cultural bias. We can say that this is cultural bias in mental health because actually mental disorder shouldn't be different between ethnic group in any countries, because we cannot say that we cannot claim that there is a variation of mental disorder between ethnic group in all population. Yeah, so if you see that is a significant prevalent, then it will be cultural bias, cultural bias in mental health. Another example is less severe disorder case. South African and African Caribbeans significantly less than white. This is another cultural bias, because they say that according to this report that South African and African Caribbeans significantly less cases of severe disorder than white. Okay, so meaning that white is superior, then does it mean that white is superior in mental health? Then South African and African Caribbean. Okay, so if we have this kind of thought, then it is a cultural bias. So we have a thought of cultural bias. Okay, another thing is a cultural stereotyping. Another cultural bias that that have in the mind, in the thought of many people. For example, black and white people among Western population, they have a mind that they have a thought that white is better. White is better. Okay, white is superior than black people. Okay, another thing is a cultural blindness in diagnosis. Usually they use white population as a normative, as a gold standard. Meaning that if for example, if black people cannot reach certain criteria of for example of a health level or well-being level, so that if their level of well-being is lower than white population, so they are worse. These black people, his claim is a worse is a worst of group. It's a worst group, in term of health. In term of health, so because they use white population as a gold standard. Okay, it shouldn't be like that. They cannot use white people as a gold standard. Okay, meaning that they put white people better than black people. Okay, so this is a three aspect of culture bias. Source of culture bias in culture. Several point here that contribute or can be a factor or source of bias in culture. Stressful life experience, minority group experience exploitation, deprivation and harassment, and stressful life experience can be one of the source of bias, yeah, because usually minority group experience exploitation, deprivation and harassment. That's why we can see the difference of stressful life experience. This is one reason why especially in Western country, Western population, can see the different pattern of mental health because of this stressful life experience. Secondly is social class and mental health. Okay, for example, neurotic disorder. Okay, neurotic disorder diagnosed more in higher socioeconomic group. Okay, so we can see the source of bias from social class and mental health. Okay, actually this neurotic disorder is it's not only in higher socioeconomic group, can also from lower socioeconomic group. So because the pattern of observation from the previous report indicate that neurotic disorder diagnosed more in higher socioeconomic group. Okay, and the third one is coping resources. Middle and upper class better in coping resources, access to professional service. This is another thought that the way of people understand coping resources. Middle and upper class have better in coping resources compared to low class. Okay, that's why they better in access. They are better in access to professional service. Okay. Another thing is the different hypothesis. Mental disorder is a consequence of the social class, socioeconomic class, not the vice versa. Okay. Mental disorder is a consequence of social class. Social class and socioeconomic class affect socioeconomic class and socioeconomic class or social class affect the mental state of people. That's why people got mental disorder. This is according to the Drift hypothesis. Not mental disorder first, then after that affect the social class, socioeconomic class. Okay, it's not that way. Okay, bias in classification and diagnosis. Upper class receive a more favorable clinical judgment and more likely to be offered psychotherapy. This kind of situation also happen. Okay, bias in classification and diagnosis. Upper class receive more favorable clinical judgment and more likely to be offered psychotherapy. we don't know whether this one is actually true or not. Is this a real situation or not? Upper class receive more favorable clinical. Okay, this is maybe the yeah just I will assume we we don't know whether this one is a true situation or not. Upper class receive more favorable clinical judgment, but it can be one of the source of bias, cultural bias. Gender bias in mental health. Certain mental disorder are diagnosed more frequently in men. Certain mental disorder are diagnosed more frequently in men. Okay. Another one is another thing is biological differences. Schizophrenia is more prevalent in men, but equally prevalent beyond female menopause. Women suffer more from depression. Okay. From this point, biological differences. Report says that women suffer more from depression. Okay. If you look at the previous study, it's like that. Women suffer more from depression. But the question is that whether is it true or not? Women suffer more from depression than men. Okay, so this is the thing that sometimes control our mind in making in making in our professionalism. Okay, and stereotype judgment. We also have this kind of thought. Stereotype judgment. We have this thought that we say we believe that man is independent and woman is more emotional. Okay, so this is the source of bias that sometimes greatly contribute to our professionalism. Okay. If you look at here, according to GCN504 diagnostic descriptive for personality disorders, which is more prevalent in male, some in male, some in female. Okay, like his histrionic personality disorder. It is a pervasive pattern of excessive emotionally and attention seeking. It's more frequent in female. Meanwhile, dependent personality disorder is a pervasive and excessive need to be taken care of that lead to submissive and clinging behavior and fears of separation. Okay, it's more in female. It's more frequent in female. But for this two, narcissistic personality disorder is more on male. Okay? It's a pattern of grandiosity in fantasy or behavior, need for admiration and lack of empathy. Okay, obsessive compulsive personality disorder, a pervasive pattern of preoccupation with orderliness, perfectionism, and mental and internal control at the expenses of flexibility, openness, and efficiency. Also most frequently in male. So, okay. So, sexism, gender bias in assessment and diagnosis. So, sexism occurs in assessment and diagnosis in 4 ways. Why? Ni. Okay, Okay, why? We tend to, when we, when let's say, why we have certain way of thinking, certain way of thinking that we tend to say that you are you are man, so you are more independent. Okay, you are woman, you are lady, so that you are more emotional. Why we have that sexism, sexism, this kind of sexism kind of thinking. Okay, so sexism occurs in assessment and diagnosis. It happens in assessment and diagnosis in four ways. Because we disregarding environmental context. Okay. Assessment and diagnosis focus primarily on trait and behavior of the individual without regard to the environmental context, such as poverty, powerlessness. A judgment are often made without taking into account the person respond to the environment. Maybe because we disregard environmental context. For example, like poverty and powerlessness, we do not account the other factors, environmental factors that that make us to have this sexism, this sexism thought. Okay, so disregarding environmental context. Secondly is differential diagnosis based on gender. For example, if female and male client present the same symptom but different diagnosis are made, then gender bias is occurring. Okay, if female and male client present the same symptom, but we make different diagnosis. Okay, so this is what we call gender bias. But gender bias happen there. Okay. Okay, sometimes diagnosis classification use this description, such as dependent and submissive, which is more likely to be associated with a female stereotype. Okay, so differential diagnosis based on gender can happen because of this sexism thought. And then the third one is a therapist misjudgment. Therapist misjudgment. This actually associated with belief. Because of sex role stereotyping, therapists may have a preconceived idea. We have therapists, mental health professionals have preconceived idea about particular symptom and may therefore perceive the system more readily in either male or female. Okay, as they have this preconceived idea about a particular symptom. Okay, and then therapists may be unaware that they are making the assumption. Okay, this is the situation of therapist misjudgment. And then the fourth one is theoretical orientation sex bias. Sometimes diagnosis is often made on the basis of the therapist's own theoretical orientation. they have their own theoretical orientation. Okay, maybe from their reading, from from their life experience, that create a theoretical orientation in themselves. So this leading to the sex bias. Okay, multiculturalism and cultural competence in mental health care. Okay, cultural competence we can be determined. Can be determined, or you must have these three components. When we want to say about cultural competence, it must have these three components: cultural sensitivity, cultural knowledge, and cultural empathy. Uh, okay, so cultural competence, you must have these three qualities to say that someone is a cultural competent. Cultural sensitivity, cultural knowledge, and cultural empathy. Cultural sensitivity is an awareness and appreciation of human cultural diversity. You mean that we sensitive to the we awareness and appreciation. We aware and appreciate human cultural diversity. Sensitive, as I had mentioned last time. You have to be sensitive to our client. Yeah? In terms of their cultural value and so on. Secondly is the cultural knowledge. Cultural knowledge, the factual understanding of basic anthropological knowledge about cultural variation. Usually, cultural knowledge can be obtained through reading, consultation with experts, a meaningful interaction with individual of diverse background to get cultural knowledge. Usually from reading from your own observation. Yeah. Okay. So through that you can get knowledge about other culture. And the third one is the cultural empathy. Capacity meaning the ability, to connect emotionally with the patient, with the client, cultural perspective. Okay, not only have knowledge, not only you have sensitivity, but you must have empathy. Empathy. If you have this alignment, meaning that you have the ability to connect emotionally with the patient, with the client. Okay. Bioethic and its cultural underpinning. Principle based. Okay, principle based ethic is actually is the principle based ethic, as I mentioned previously, it is the principle of ethic. like malefficient, uh, and several several principle that in my previous slide. This is a principle based ethic. Uh, it's a principle ethic is about moral judgment and decision making. This is what we define with this is definition. The definition of ethic. It's about the moral judgment and decision making, and uh, the purpose of this principle based ethic to identifying and balancing the conflicting moral principle. That's why this principle based ethic uh, apa uh, are listed and uh, listed by the APA to identify and balancing the conflicting moral principle. So if you look at these four important bioethics okay, non-malefficient, beneficent is a value shared, and respect for anatomy and justice. Okay, this one I have mentioned in my previous slide, but this one is here because this one is just to show you that that the aspect of bioethic that underlie the cultural underpinning, that underlie the cultural the cultural perspective that we discuss in this section. So this malefficient, beneficent, which are value shared, respect for autonomy and justice is applied in this cultural underpinning. Another thing is that doing good may have more particular meaning in Western. Again, when you use this moral-based ethic principle, again you have to you have to consider the cultural aspect of this principle-based ethic. Cultural aspect, the cultural value, sensitivity of the cultural sensitivity, culture empathy. For example, doing good may have particular meaning in Western. The importance of action rather than simply being. In Western population, doing good may have more particular meaning in Western population. It's different from Eastern and other part, and people in other part of in this world doing good. In Western population, their interpretation is different for doing good. For them, doing good is they need to see the action of doing good rather than simply being good. Okay. Some population they accept a passive acceptance. Okay. Meaning that action to do good may be less highly priced. Action to do good may be less highly priced in certain population. Okay, compared to Western population. Some population passive acceptance. Passive acceptance is acceptable in their community. But in certain population, doing good with action is acceptable than just simply being good. Okay, just to show you the apa the cultural underpinning, yeah, in relation to this principle based ethic, especially when you consider the this cultural sensitivity, this cultural empathy, along with this principle based ethic, yeah, mal efficient, beneficent, respect for autonomy, justice, and so on. Yeah. Uh, Another thing is for autonomy, respect for autonomy is tied to Western culture value, individual value rather than group value, because it is believed that Western population, uh, their value, they are individual, they carry the individual value rather than group value. It's different from Eastern culture. Eastern culture is claimed that they are more group value. Okay, and all these individual group value and so on, it has connection with autonomy. Yeah? For example, during your session, when you have clients with female, especially female, and this female has husband. Okay, decision has to be made by her husband. Okay, not like a Western population. Western population, they are more independent. Decision is made by themselves. Okay, in the case of female, and some population, okay, their decision is made by family. Okay, and in Western population, they make their own decision. This is the variation of value, population culture value between Western, Eastern, and other part of this world. This is all. All this have a connection with autonomy. Okay. Ethical challenge and opportunity in treating diverse patient. A different value and belief between mental health profession and client patient sometimes create dilemma. Because sometimes mental health professional, they have different value with their client. So this create a lot of dilemma in the therapy session. I have several example here. You read this scenario, yeah, yourself. Okay, if you look at this case, this is about one psychologist had a Japanese client with suicidal ideations. In off session, client gave an expensive gift to psychologist to express gratitude, and then psychologist refused to accept the expensive gift. Client feeling hurted. So what should what should this is kind of a dilemma. This is one kind of dilemma that can happen. Uh, According to APA suggested that accept small gift is okay, but not expensive gift. Just a small gift is okay, according to APA. And then mental health professional or therapists also have to consider that rejecting the gift cause more harm than good. This is another thing that therapists should think, because we have to consider the client feeling. If you reject if we refuse to accept the expensive gift or any gift, but what you can do is that just tell the client that we cannot accept the expensive gift. Yeah, this small gift can be considered. Okay. Just to show you the dilemma in dilemma that can happen. Another thing is okay, this case, you read this one. Okay, in this case, what you should do is to approach empathically. You have to approach your clients empathetically. Okay, because in this case, client use two kind of medicine, modern medicine and traditional medicine, and then and this therapist is not comfortable with this client action, using two kind of medication. So we as a mental health professional has to explain the client. First, you have to explain the client what is the existing data about the situation. In this case, we should inform patient that there is no good data. There is no reliable valid data indicate the effectiveness of the traditional medicine. Okay, this is you have to tell. In this case, you have to tell the truth. From the aspect, from this lacking of data. Okay, because this is another way. This is the way that you should use. But at the same time, you have to demonstrate respect. Demonstrate respect to your client. And then the point here is that you must educate. You must educate the client. Tell the client from I said just now, there's a lack of data, and then in this case you must show your empathic, your empathic response, okay, and demonstrate respect. This is part of the cultural, because if you look at this case, Mr. L, uh, he used traditional medicine, okay, the medicine to solve solve his illness, solve his medical condition. So medical use traditional medicine. So this is part of the cultural issue that we can see in this case. This is the last case. You read this one. Okay, so in this case there is injustice. This issue of injustice. Issue of injustice or discrimination. Discrimination. Okay, between different race. Different race. Okay, different race. So if you look at in this case, okay, I think you can understand this case. So how to improve? The question here is how to what is the correct way to improve the situation. So this is okay. So this the situation cannot be like this. This is discrimination and injustice in the treatment of diverse population. What we should do is another possible suggestion is that a far more acceptable approach would be one based on need. Should be based on need, with the sicker patient or more complicated cases going to the social worker with greatest expertise. Okay. Alternatively, the principle of equality might lead one to assign patient randomly to therapists based on the order in which they contact the clinic or first seen. Okay, that should be first come, first serve, right? Okay, it should be like that. Not based on this. Not based on skin color and class. So okay. Okay, that's all my lecture. I have little bit. I have about 4-5 slides to complete, but that one next slot, because next slot we have 3 hours. First for first hours, I will finish my lecture, and next 2 hours for your presentation. Okay, and then the last slot is somewhere on 3rd January, I think, also for presentation. Is it okay, student?
Okay.
It's fine.
Okay. Okay, that's all. And good night. Okay, thank you.
Assalamualaikum.
Thank you, Doctor.